Yes, hello everyone. Today I want to talk about very important topic. I want to talk about a topic which is going to save a lot of people's lives. I want to talk a topic so that I pass this knowledge to everyone who is listening to me for your own benefit. I'm doing this out of my heart. I'm doing this so that I help people there. I'm doing this so that I impact good life to people who are watching. Today I want to talk about the reason why many people are dying because of cancer. I want to talk about the reason why many people are getting cancer. I want to talk about the reason why many people are detecting cancer when it's in late stage. I want to create this information to everyone because as we speak, in every family, 1 or 2 people get affected because of cancer. And I want to give out this information so that I save people's lives, because I've realized many people are perishing because they lack this basic knowledge. Number 1, many times when we go to hospitals, we go because of pain. Few people go to hospital because of checkup. People go to hospital because they have pain. That is the reason number 1 why people go to hospital. The second reason why people go to hospital is because they have infection. Because they have signs and symptoms of infection. There are those type of infection which they might not come with pain, but they come with different signs and symptoms. For example, if you have issue to do with the uterine infection, you will end up having vaginal discharge. For example, if you have the prostate infections, you will end up having complications such as erectile dysfunction or premature ejaculation. So sometimes people go to hospital because of pain or because of signs and symptoms. I want to say this. The reason why people are dying because of cancer, or the reason why people get to know they have cancer in late stage, is because all this infection we are having, all these signs and symptoms we are having, it could be the signs and symptoms of cancer. Cancer does not have special signs and symptoms. Cancer has the same signs and symptoms as the normal infection you normally get. Last time I said, if you've been having a lot of headache, severe headache, still it can also be sign and symptoms of brain tumor or brain cancer. And still, other infection presents with the signs and symptoms of headache. So I'm not saying if you have headache, you have cancer. But still, brain cancer presents with the same signs and symptoms as the headache, as symptoms of other infections. So I want to say this in simple way. Cancer hides inside the infection. Cancer hides behind the infection. So if you have a good doctor, when you go to hospital because of infection, they need to see beyond the infection. It's okay, you've come because of headache. Maybe the headache is because you have pneumonia, you have tonsillitis, you have infections. It's okay. I will treat the infection, but I also need to see beyond these infections. Many people who've been having gastric cancer, they go to hospital because of signs and symptoms of acidity. Most doctors, they'll treat the acidity, but they might not go beyond the infection. So my advice is this. If you're a doctor, you're watching me, or if you're a patient, you have a doctor, it's always good to see beyond infections. it's always good to see this infection in all angles. It's okay, you will treat the infection, but you also need to ask yourself, what is behind this infection? Because cancer present with the same signs and symptoms as normal infections. Cancer does not have miracle signs and symptoms. It presents with the same signs and symptoms of infections. So, my point I'm trying to make is, make sure you do screening. If you've been having infection and the infection, you keep treating it on and off, as much as you are treating it, also make sure you do screening or you do checkup for this cancer. That is one. If we come up with that habit of doing checkup, if we come up with that habit of going to hospital, not because of pain or signs and symptoms, but going to hospital because of checkup, then we'll start war against this cancer. We'll start war against this cancer. We'll get to discover we have cancer when it's in early stage, and in that way we'll be able to get better treatment for this cancer. There are different type of tests you can do to see if you have cancer. We call them tumor markers. These are just simple blood tests. You do blood tests, you check, you get the result within 24 hours. And if there is any signs and symptoms of this cancer cell, we'll be able to see from the blood works. So once we see, then we recommend for more tests. You there, you've been having abnormal signs and symptoms, and you need to check up. You need checkup. We are here to help you. We are here to guide you. There are different machines. I know sometimes we might be having problem with these machines to do tumor markers, but I'm sure in every country, in every town, there are those machines. You'll get those labs with those machines. We call them tumor markers machines. Don't hesitate. Just go and do checkup. For men who have been having issues, you can also, there's a test we normally do called PSA, prostate serum antigen, to rule out any complications of prostate. You are there, you need our consultation, you can contact me. My number is +254 723 632 448. If you're not in Kenya, if you're in Kenya, 0723 632 448. Thank you very much for your time. Thank you.